Lighting okay and everything?
Good. Hello, everyone. Thank you for joining us today. We're going to wait a few minutes, about 3 minutes approximately. We've got a number of different people that are coming into the webinar right now, just watching the numbers go up and up here. We've got a very large crowd for our session today with Dr. Brandon. We're really excited to have you all join us. So again, it'll be about 2 minutes or so, and then we will jump in and get started. All right, good afternoon, everyone. I hope everyone is enjoying a nice lunch at this point in time. We've still got a number of different people that are dropping into the webinar, but I think we'll go ahead and get started. And first off, I want to say thank you so much for joining us for this webinar this afternoon. We are going to be starting a series of webinars that are going to be lunchtime webinars. Now that everyone is familiar with Zoom, it makes it a lot easier and something that everybody's kind of used to. In this world of social distancing, it becomes an outstanding option for us. So I'm going to start off. I'm going to give you a little bit of information about facial aesthetic concepts. As most of you know, you are all patients of facial aesthetic concepts. So we have been around in Orange County for 40 years, and we're in fact celebrating this year our 40th anniversary in Orange County. So it's quite an accomplishment, and we're really thrilled to be back in business, particularly this year, 2020. As some of you may know, we actually are participants in the UCI fellowship training program. So there are facial plastic surgeons that actually come to our surgery center and observe surgeries that are cosmetic facial surgeries in order to learn about how to perform them. In addition, FAC has been voted the best of Orange County now for 13 years. So we have all of you to thank for that, because this is something where patients and individuals within Orange County vote for their favorites, and we have been that for 13 years. So thank you for that. With FAC, we've got a number of different individuals that are part of this practice. Dr. Richard Gangnes, who is actually my father. And forgive me, I didn't introduce myself. My name is Chris Gangnes, and I'm the general manager of Facial Aesthetic Concepts. And so Dr. Gangnes is one of our surgeons in the organization, and as well as Dr. Bryan Brandon, who is going to be hosting the meeting today. He is a facial plastic surgeon as well. So Dr. Brandon has recently joined us from New York, and we're thrilled to have him on board as another facial plastic surgeon in our organization, expanding upon the key of what it is that we provide here, which is facial plastic surgery. In addition, we have 3 dermatologic specialists. So these are individuals that many of you may know, Sharon, Cassandra, and Haven. Each of these individuals performs a number of different non-surgical procedures. So Botox and fillers and lasers and kind of everything in between. Then we have 4 medical estheticians, and those are Nikki Behosh, who is our managing esthetician, Mary Granger, as well as Brooke White and Erin Pomeroy. We do have 3 offices around Orange County. So there is the office in San Clemente, which is where I'm located now. It's our primary office, and it houses our surgery center. In addition, we have offices in Aliso Viejo and Rancho Santa Margarita. So we have spread out throughout the South Orange County area to make it more convenient for our patients. And as I mentioned, our accredited surgery center is adjacent our facility in San Clemente. And it is a HHC accredited facility. And we have board certified anesthesiologist surgeons, as well as an overnight suite that our patients take advantage of quite frequently. So as we look at what it is that FAC offers, we offer a very wide variety of aesthetic services. And our primary objective is to be able to provide a single source for all of your interests as far as both surgical as well as non-surgical needs. So most recently, facial plastic surgery has experienced an explosion in minimally invasive techniques to change the stigma of facial surgery from the typical tight looking faces that don't look natural to minimally invasive procedures that restore a natural rested appearance. You'll see that we do perform everything from eyelids to fat transfer, micro lifts, neck lifts, as well as rhinoplasty. And Dr. Brandon today is going to be going through a number of these different options, particularly as it relates to the eyes. Today's presentation is focused on the concept of our eyes and how important they are in today's world of wearing masks. In addition, we do also offer breast and body contouring, so tummy tucks, breast lifts, and other types of procedures such as liposuction. And then we offer a whole wide range of non-surgical aesthetics, which have really grown substantially in the last several years. That includes Botox and fillers, PRP, which is platelet-rich plasma. As many of you have heard of many of these things, they are an expanding area where we can improve upon not only just the contours of the face, but as well as the skin's appearance and the health of that appearance. We also offer hair restoration as well, which is a growing element of what it is that we do here. Dr. Brandon is actually also a hair restoration specialist. So we do both non-surgical and surgical approaches to hair restoration. And then our estheticians are the ones that perform all of the fun things like facials and chemical peels, micro needling, as well as micro blading. So this rounds out our service offering and really provides a comprehensive offering for all of our patients here. So on that note, I will turn you over to Dr. Brandon. He will get started in his presentation about eyes and eyelid procedures. Dr. Brandon, please go right ahead.
Hi, everyone. My name is Bryan Brandon. And yes, I have 2 first names, and no, I won't be upset if you call me by one or the other. I respond to both. Thanks for tuning in today. I really appreciate you taking some time to listen to what I have to say. I'm a California native. I grew up in Northern California. I went to Cal Poly San Luis Obispo, where I studied biomedical engineering, as that was my roadmap to getting into medical school. I probably could have chosen an easier one, but nevertheless, that's what I did, and I had a good time. But ultimately, I went and transitioned to UC Irvine School of Medicine, where I got my doctorate of medicine. And then my training actually took me out to North Carolina, Chapel Hill, North Carolina. I'm a Tar Heel for a surgical training in head and neck surgery. One of the premier institutions in the country for such training. And then finally, I actually went up to New York to study under prolific facial plastic surgeon Vito Quatella, who mentored me for the course of the year, and I actually stayed on with his practice for a short time afterwards before deciding I was tired of cold, dreary New York and wanted to come back to California. So here I am, newest member of the facial aesthetics family, and very excited to be here. Just a little bit about my experience, over the last year or two. I've completed a large number of cosmetic surgeries, over 100 eyelids, over 160 rhinoplasties, and easily over 250 facial rejuvenations of all different forms, and then over 100 neck lifts. One of the things that I really enjoy doing actually is medical mission work, and most recently I traveled to Guatemala where we did cleft lip and cleft palate repairs, as well as microtia repairs for children who are born without an ear. We can actually reconstruct ears out of rib cartilage to give them a hope of some sort of normal life where they're not ostracized in their society. Was going to go to Vietnam and Ecuador, but coronavirus had different plans. So those trips are on hold for now, but that's something I plan on continuing to do. So I wanted to go over a little bit about our philosophy here. And primarily we look to achieve natural results for patients, and bring your face into more harmonious and more balance. You're not looking to make changes where you're not going to recognize yourself afterwards. We want you to look natural and just a more youthful, younger version of yourself. I firmly believe there are no shortcuts to quality, particularly in this work. This is your face. Every little thing matters. So, I believe in doing everything 100% the right way. And I don't take shortcuts. And then, of course, always doing the right thing by the patient. That's always my number one goal. Moving on to just some general background about how your face ages. And we'll talk more in detail throughout the webinar about all three of these. But the three main types of changes is you get textural changes in the skin, you get volume loss in the face, so fat in your face, muscle, the amount of your skin actually undergoes a volume change and you lose that volume as you age. And then finally, gravity is no one's friend when it comes to aging, and you have gravitational changing. And, all three of these changes can be related to sun exposure, poor diet, alcohol, stress, medications, genetics, and a host of other things, but they all lead to one of those three components. And every single person has varying degrees of textural changes or volume changes or gravitational changes. And so thus, not every person ages at the same rate. So, you can't address everything with a cookie cutter approach. You can't just do the same procedure or the same treatment for every person that you have tired looking eyes, because that's not going to get you the results that you want. So I believe in a comprehensive rejuvenation, and your best results are going to be when we target all three different prongs of facial aging: skin texture, gravitational, and fat loss. And when I treat a patient, I tend to look at the patient as a whole person. I have a holistic approach. Some surgeons, they just want to operate, and when you have a hammer, everything is a nail, and that's what they want to do. I don't believe that's always the case, particularly with eyes. And as Chris said, we have a host of minimally invasive, non-invasive treatments that can really stave off the need for any sort of surgical intervention for a number of years. And that's something that I'll go into here soon. And this brings me to another principle that I believe in is, gone are the days when the doctor tells you this is what you need, and that was the end of the story. This is going to be a collaborative experience when you come in to see me. We will talk about what your goals are, what bothers you, and I will guide you. I will show you what can and can't be accomplished, and ultimately our decision on what we end up deciding to do is a collaborative effort between you and I, and it's individualized. No patient gets the same thing as the patient before. Everyone is different. So let's talk about some of the changes that we see in the aging face. So when you are young, everything is high, vertically high. The eyebrow, the tail of the eyebrow is arched and pulled up. The cheek is high. You have high cheekbones. Your lower eyelid is very short. And then of course your jawline is nice and tight. You have a nice discrete jawline. You don't have loose skin. The same thing with the neck. As you age, you start forming wrinkles here. Gravity starts pulling your eyebrows down. Your lower eyelid actually starts to elongate. Same thing through the cheeks. Cheeks start coming down, so gravitational changes. Volume loss happens, so you start losing volume in the what we call the midface or the cheek. That combined with gravity tends to cause folds here around the nose that we call nasolabial folds. Down here in the lower face, we call this the jowl. And then in the neck, you can get banding, loose excess skin. All those things contribute to the aging process. This is a very interesting slide. This actually shows the fat pads in your face. So underneath your skin, you have a series of fat pads that are in all these different regions. When you're young, say 35, these fat pads are nice, have great volume, and they're in the position that they're supposed to be in. As you age, say you go into the next decade, the fat pads start to atrophy or start to shrink in volume. So you can see they start getting smaller, and they also start shifting downward thanks to gravity, of course. And then finally, in the next decade, again, further atrophy, further volume loss, further gravitational pulling, leading to the jowl formation, leading to bags under the eyes, tear trough deformity, all of those things. This is another side-by-side example showing essentially the same idea. It's a little easier to see the difference in the fat pads as a young patient to an older patient. Long time ago, we used to think that aging was really just a soft tissue problem, meaning it really only caused issues with skin, fat, muscle. So we thought that skin, fat, and muscle would atrophy and sag with gravitational changes, but a very interesting study was done not too long ago where they actually took CT scans, CAT scans of your bones in your face in patients when they were younger and then again when they were older. And the interesting thing that they found is that there's actually a significant amount of bony loss as you age too. So it's not just soft tissue, it's actually the bone structure of your facial skeleton changes and contributes to the aging process. So it's a little hard to see, but one of the biggest changes you see is right down here, right? Basically at the base of your nose, above your teeth, gets resorbed and shrinks back into the face. This is actually what makes your nose look longer and droopier as you age, because the nose is quite literally falling down because it's losing its base of support from the bone. Now, with regards to the eyes, which is what we're going to talk about today, there are also changes around the eyes. Here you can see a nice high orbital rim, which is what we call the bone around the eye socket. As you age, you lose that bone and you start getting basically your eye socket enlarges. And then finally, the jaw itself, nice large jaw here when you're young. Again, shrinks as you age, becomes smaller, more brittle, and much more diminutive. This picture shows the same thing, but side by side. And I actually have one more picture that I think displays it even better, particularly with the eyes. You can see with the eye socket, where your eye sits, and then your nose. Compare that to here, same person, just a matter of a couple decades. And this is widened. You tend to lose a lot of bone down through here and up through here. And then again, around the nose, this entire aperture is what it's called, enlarges and sinks into the face. That contributes to the volume changes that you see in aging. So now that we've talked about skeletal changes, time to talk about skin aging. So as you get older, you will start getting thinning of the skin, loss of elasticity. Here's the outer layer of your skin, nice and plump. The inner layer of your skin, again, nice and plump. And then below you have collagen, elastin, nice organized, thick fibrils that are giving you your nice plump skin. As you age, you actually lose the amount of collagen and elastin, and they become disorganized. And that is what contributes to aging of the skin itself. So that is the loss of elasticity, the loss of volume. You get dyspigmentation, brown spots, red spots, sunspots, primarily from environmental factors like sun exposure, smoke exposure, those sorts of things. Wrinkles. Again, as you lose your collagen and elastin, your skin's ability to maintain a nice plump skin surface is impaired, and you start getting wrinkles. It's also due to muscle action. I'll go into that in just a little bit, and why Botox is great around the eyes. Finally, laxity, gravity, volume loss, skin changes leads to laxity, and as you can see, just kind of loose skin hanging on the neck. Dryness, your skin loses hyaluronic acid, same thing that's in fillers, and that's a major hydrator of your skin, and you just lose the amount of that and the quality of that as you age. So targeting all of these things, particularly around the eyes, can make a big difference without needing surgery. Here's a side-by-side comparison. I want you to notice how there's a nice upper eyelid shelf here that say you could put makeup on, but a nice full upper eyebrow, or we call it the infrabrow region. As you age, you sort of lose that fullness and that light reflex, and the skin starts coming down, sagging over the edge of the eyelashes. The lower eyelid, nice and short in the youthful eyelid, high cheekbone, full cheek. As you age, that lower eyelid becomes longer. That makes you look much older. You lose volume in your cheek. Volume comes down, leads to jowl formation. So what makes a beautiful eye? I touched on it actually on the previous slide, but again, it's not a large amount of your upper eyelid that shows. A youthful, beautiful eyelid has actually very full infrabrow region that reflects light. That's something that we pick up on. The eyebrow itself, I'll go into this in the next slide, tends to start here at the corner, arches, usually about the outside corner here, although that can vary depending on preference, and then reaches a tail out here. The lower eye itself, without wrinkles, dyspigmentation, and it's short. The lower eyelid ends right about here, where her cheek ends right here. And no hollowness here, no real dark circles. Same thing here and here. So all variations on what we generally consider to be a beautiful eyelid and eyebrow complex. So just like I was saying with the eyebrow, tends to start here, arches out through here to match up with the outer edge of your eye, and then the tail comes out to about here. Now, the eyebrow actually is one of the more variable things and can be modified. And as you noticed, probably it's becoming more in vogue for eyebrows to actually be a little lower than what we're showing in this picture, and maybe a little heavier, not as finely plucked. So that can change, but the overall aesthetics of the eye itself and the upper eyelid and lower eyelid are much more constant. Those have not changed as much throughout the decades. So now putting it into perspective, here are just some examples of eyebrows and eyes on some actresses that everyone I'm sure will notice. Angelina Jolie. Again, very full here, not a lot of upper eyelid showing. And then, of course, very short lower eyelid, high cheeks, good volume here, no tear trough deformity. This edge of the eye and this edge, this tends to be a couple millimeters actually higher on the outside than this edge. So downward slanting eyes is not what you typically see. Again here, you'll see an upward slant. This is Megan Fox. So again, full here, small amount of upper eyelid, very short lower eyelid. That's a youthful appearing eye. Mila Kunis, same thing. All right, so now that we've talked about what we look in for a aesthetic goal, we can talk about some common concerns. People come in, they want to know about puffy eyelids, their tear troughs, dark circles, bags, aging with loose skin or wrinkly skin or sunspots all around the eyes. And we have different treatments for all these different things. So we'll get started first by talking about wrinkles. Wrinkles form through the aging process that I told you, but primarily it's because muscles are actually contracting over time. And if you're a very expressive person, raising your eyebrows, making an angry face or a concerned face, that can lead to the muscles of facial expression, which in the upper brow is the procerus muscle and the corrugator muscle. This can lead, when these contract over time, the corrugator muscle can lead to the 11s that you see right here. And the procerus muscle, which is this big one, can lead to that horizontal crease that you may get here. So repeated actions over many, many years is what forms those lines, with first on motion, and then if it keeps going and you haven't done anything about it, they'll form at rest and they can be very difficult to treat. Botox is the mainstay for treatment for these and can give you a much more well-rested, less angry face. If you have family members or friends always asking you what maybe is bothering you or what's on your mind, it may just be because you may have some creases here in your central forehead that Botox can improve. I consider Botox to be one of the safest things that I do. It's a purified protein that basically is injected into one of those muscles that I was referring to and weakens them, keeps them from contracting so that the wrinkles don't form. And it can be done at a very young age. It's being done with patients in their 20s now as a preventative measure to prevent those wrinkles from forming, because that's probably your best an ounce of prevention is worth way more than treating after the fact. And then finally, if your wrinkles are set in and Botox is not fully treating them, fillers, Juvederm, Voluma, Restylane can actually be used to fill in those lines and improve those lines. Here's some examples of Botox to the forehead. And this patient is raising her eyebrows, but she has a very smooth forehead. And again, you can tell that she is trying to give an angry face, and you can see the subtle lines here, but they're much improved here. Another example, Botox to the forehead, smooths the horizontal lines. Botox to the central forehead, or the glabella is what we refer to it, will smooth out the angry 11s. Crow's feet. This is something that I see patients for very, very frequently. As you age, when you smile, your cheek, the volume of your cheek moves up. Your eyebrow comes down. So you start getting these wrinkles here. Botox is excellent in smoothing those wrinkles out. One of the added benefits to placing Botox in this region is that you can actually get a subtle brow lift. So you take a look, her brow is here, Botox to her crow's feet, and you have a nice subtle brow lift because it's releasing the muscle that's pulling the eyebrow down. So it's releasing that muscle and the eyebrow can move up. Gives a very attractive brow lift. All right, moving on to dark circles. Also something that I see very, very commonly in my practice, and something that I think many people struggle with. And it can be caused by a number of things. It can be hard to figure out exactly what the cause is. And honestly, seeing it in person and actually feeling the skin and closely examining the skin, you can usually tell what's going on. But the first thing that I always look for is pigmentation of the skin. Sun damage, smoking, aging in general, genetics can all lead to pigmentary changes of the skin, darkening of the skin itself under the eyelids. As you age, the skin of the lower eyelid, or either eyelid really, is the thinnest skin in the body by far. It's the only place in the body where you have skin directly on top of muscle. There's no intervening fat in between. The skin can be so thin in this area that it can actually become somewhat translucent, and you can somewhat see the muscle coming through the skin. Finally, hollowing. If you get what's called a tear trough deformity, which occurs right here, it's hollowing that you actually see. And the darkness that you notice due to hollowing is actually from shadow effect. So you're actually getting a shadow underneath the eyelid itself, and that's leading to a dark circle. And then you have swelling. Swelling can be due to a host of things. It can be genetic. It can be due to medications, blood pressure medications, lipid medications, cholesterol medications. It can be due to heart disease, lung disease, liver disease, all sorts of things. Allergies is another big one. So really trying to figure out what is the underlying process for dark circles is always very, very important. And one reason one treatment is not always the solution for, maybe work well for one person but not work well for the other. And then the final thing are actual true eye bags. This patient doesn't have it so much, but I'll show you some pictures in the future. And that is actually where fat that is usually living behind the eyes, it acts as a shock absorber for the eyes. As you age, the septum is what we call it, that actually holds those little fat pads back, loosens up, weakens, and those fat pads can actually come through and become prominent. And you have three of them. You have 1, 2, and 3. Those fat pads can become very prominent and can lead to bags under the eyes and dark circles. Now, if pigmentation is your issue, or you're seeing muscle through the skin, a lot of times different under eye creams can really help. They may have a retinol in them, and they may have a lightening agent in them, like kojic acid or hydroquinone. Those products can actually help lighten the skin and improve the skin quality and texture, and thus improve the dark circles. Now, if you have hollowing, a lot of times filler is best used. I'll show you some pictures of that in a little bit. And then finally, eye bags and swelling. Treating the swelling, if it's fluid retention, is usually the best answer, but eye bags does generally tend to be surgical treatment. So here's some good examples of tear trough. She has just subtle darkening under her eyes, and you can just see this little hollow crease here and here. Now with a 1 syringe of Restylane, which is a hyaluronic acid filler, I was able to fill in this area and camouflage that and greatly improve the appearance of the hollowing there in the dark circles. Same thing here. Now these results can be fairly subtle in pictures and tend to pick up much better in person when you see the person moving around, animating, those sorts of things. But again, you can see very young patient, hollow under her eyes here, filled in. So her eyes look much more youthful. She also got Botox to her forehead. You can see the subtle lines here and greatly smoothed out. This patient had actually fairly significant tear trough deformity with some early signs of eye bag formation. Now, tear trough filler is not always a great solution to that, but for someone who really wants to avoid surgery and just wants something that may work for a period of time, that's minimally invasive, then filler can still make a great improvement, as you see with her result here. This was, I believe, a syringe and a half, maybe 2 syringes over 2 sessions, but she's gotten a great result. So I talked about this already a little bit, but the formation of the eyelid bags, really the underlying process is bone loss and weakening of the orbital septum, which then causes this fat to droop down. It's coming down. And then the fat pads that normally reside behind the eyes start protruding. So you go from a very nice convex, smooth contour from lower eyelid down through the cheek to this sort of double bubble or double convexity here, like this. And then this shows even further recession. So when looking at eye bags, you have to make sure you're correctly identifying the problem. Is the problem is fat, or is it skin, or is it a combination? If it's solely a fat pad coming through, and this is something that if you're interested in, you can sort of self-diagnose, or at least try to at home. Go look in the mirror, and without moving your chin up, look up. That actually accentuates the under eye bags. And now, of course, you won't be able to see yourself, so you might have to take a picture. But then you can actually, a lot of times, see individual little bumps there, little pouches, and those are those fat pads that I was referring to. Now, if you have those fat pads, we need to recontour those fat pads, and that will go a long way. And sometimes that is the only problem, and that's all you need to do. And you can do that through a scarless lower eyelid lift. I'll show you what that means in just a minute. But sometimes there is excess skin. As you lose your collagen, lose your elastin, your skin's springiness goes away, and you start getting excess skin of the lower eyelids. And then you need to combine a scarless lower eyelid lift with something called a skin pinch, which is a incision that just goes just underneath the eyelashes. It's very, very well hidden, and it actually removes the extra skin to tighten up the lower eyelid. Here is such an example. You can see how she has this prominence here, which is actually probably muscle, but she underwent a scarless lower eyelid lift, and we're able to smooth this entire area out, and her eyelid looked much more youthful there. Now, this patient has clearly a much more significant issue than the last, but you can start to see what I was talking about. His problem is so bad that he doesn't even need to look up to accentuate those fat pads. You can see that fat pad, this fat pad, and then the smaller ones right there. Now, again, with lower eyelid lift, you can reduce those fat pads, smooth this contour, and he needed a little bit of skin to come off too, because this is a bunch of extra skin that was there. Now, when I talk about the scarless eyelid lift, this is what I'm talking about. So you actually go, it's hard to show you, but you go behind the eyelid, on the pink of the eyelid. You make the incision here, and this is that fat pad that I was talking to you about. You take that fat pad and you actually drape it over the edge of the bone there. And that gives you this nice, beautiful cushion here, and really smooths that contour and shortens that lower eyelid. Makes a big difference in making your eye look more youthful, more rested, more energetic. Here's one such example. You can see how she has this bulge, and then a flatness, and then kind of a bulge again. With the scarless lower eyelid lift, you have just more of this smooth transition here. She looks much less tired and well rested. I'm sure she looks how she feels inside. Here's another patient. Same idea, large bags. And the dark circles under there is really just shadowing effect. Now they've been removed and repositioned, and she has a much more youthful looking lower eyelid. This patient, same thing, large bags. Fat was repositioned, draped over, and again, much smoother contour there. And just look how much more well-rested she looks. She still looks how she did before, just more well-rested, a little younger. So these procedures, I have a lot of patients that worry that it's going to change the way they look. As you can see, it doesn't change the way that you look. It just makes you look a little more youthful, more well-rested. This patient I showed you earlier, just wanted to show you one more time. Again, very nice result here. Soften the lower eyelid. Remove the deformity there. All right, now we're going to talk about the upper eyelid and the eyebrow and the forehead, because you can't really treat just one of those without at least thinking about the other two. A lot of people would just like a little skin removed off of their upper eyelid, and for some people that may be the right answer, but other people, if their brow is too far down, then the brow may need to be repositioned. So there's usually a combination to get the optimal result. All right, this is exactly what I was talking about, and this is a nice example. This patient had an upper eyelid lift, and you can see one of the most common things that I have people coming in for is just this extra fold of skin. They basically lost their upper eyelid, and that's because, again, gravitational changes, skin is losing its elasticity, it's basically pulling down and doesn't snap back to where it used to. And so an upper eyelid lift is really just removing an ellipse of skin above the upper eyelid. And as you can see, can really be powerful in restoring the youthful appearance of her upper eyelid. So in the lower eyelid, there's 3 fat pads. The upper eyelid, there's actually only 2. This space is actually occupied by your lacrimal gland, the gland that makes your tears. And so obviously you don't want to remove that because you would have dry eye afterwards. So these are the ones that we tend to contour, and this is really the troublesome one where people tend to get fat could come through, and you can get a little bulge above your eyelid there. This shows the upper eyelid lift incision. Unfortunately, that can't be done scarless, but the benefit is that with the upper eyelid lift incision, it hides in the crease of your eye, so no one ever sees it. And being that the skin of your eyelid is the thinnest skin of your body, it's actually the best healing skin of the body too. And all of these, any incision around the eye you would think could be very prominent and easily seen. They're not. They heal very, very well. And I typically have a very hard time finding my own incisions on patients because it's healed so well. So this skin just tends to lend itself to very good healing. Even if you're a keloid former or that sort of thing, the skin does not tend to do that. I wanted to show you some examples of upper eyelid lifts. So this patient, again, she just looks tired, sad. Her eyebrows are sort of pointed down. Her skin is hanging over the outside edge of her eyes. This process can get so bad that it can actually block your vision by covering your pupil. And when that happens, it really becomes a medical problem and something that we need to do something about. But again, with the isolated upper eyelid lift, you can see just how much more awake, alert, youthful, and happy she looks. This is the same patient just from the side. I just wanted to show you how that skin is basically sitting on her eyelashes here. And then after the upper blepharoplasty, she has a nice upper eyelid that she can apply makeup to if she so chooses. And her eye just appears much more youthful. The great thing about this procedure is that it takes perhaps about an hour. It does not need to be done in the operating room. You do not need to undergo anesthesia for it. This can be done in the office under light sedation, say with a tab of Valium if you require that, and then local numbing. And then it's pretty quick. Patients just kind of snooze or relax there while we do the work. You don't feel any pain. And then you're ready to go. Recovery is not too terrible either. Patients don't tend to bruise significantly with this, and swelling is not significant as well either. I'll show you a patient or two that were less than 2 weeks out from their surgery, and you'll see how you can't tell that they had anything done at all. So the upper eyelid lift really does lend itself to doing it in the office under just some local anesthesia, some lidocaine. This is actually that patient. So she had tired appearing upper eyes that had always bothered her, and she was tired of the skin hanging over her eyelashes here. We did her upper eyelid lift, and that's all we treated, and she now has a nice upper eyelid shelf here. And this picture was taken a little less than 2 weeks out after her surgery. Here she is from the side. Again, heavy brow, and then the upper eyelid now shows. This patient, you have to use your imagination a little bit because she has a lot of makeup on here and none here, but you can see how low her eyebrows were. And this is what I talk about when, one treatment works for one patient, but not necessarily the other. If we would have done just an upper eyelid lift on her, I don't think we would have made a lot of progress, because she actually has skin from her eyebrow coming down. Her eyebrows are so heavy that is what is folding over onto her eyelashes. So we actually did what's called a temple lift, which is a small incision up here in the hairline. And it just very subtly, slightly elevates the eyebrow out here on the outside, which is really nice. It looks really great on her. And you can see how much more upper eyelid she has now. And if we would not have done the temporal lift, I don't think we would have gotten nearly as good a result. You can see she just looks a little sullen, tired, maybe even angry or upset, and here she does not. And again, this is another patient that was less than 2 weeks out from surgery. So this patient is kind of the next step up. So you can just do an upper eyelid lift to target the skin. You can do an upper eyelid lift with a temporal lift to target the outside, the corner of the eye. But when you start having big creases and furrows here, and Botox stops being as effective in treating those, you could try filling these in, but it doesn't tend to work very well. You're really left with a surgical treatment, and that's a brow lift. Now, these aren't the brow lifts of 10 or 20 years ago. We do these brow lifts endoscopically, meaning we do small incisions up behind the hairline that are only about an inch long at most. And we use small instruments and little telescopes to get all the way down onto the forehead and release these muscles and actually improve the furrow. So this patient's had no Botox here since then. She had a endoscopic brow lift and an upper eyelid lift, but you can see how much smoother her central forehead and the upper side of her nose looks now, and how much happier and well-rested she looks. And the point of this webinar really was just the fact that everyone's walking around with a mask these days, and it looks like we're going to be doing that for the foreseeable future, unfortunately. And so your eyes have just become more and more important. No one else is really looking down at your lips or your jawline or your neck because they can't see them anymore. So the eyes have really become more and more important through the pandemic, as people really try to look their best and feel their best. This is a great example of a patient who thought that maybe she needed an upper eyelid lift because, again, she's got skin hanging over the eyelashes. But in reality, her brows are so heavy, and sort of the telltale sign here is this horizontal crease. And again, you can see she's very, very young. So heavy brows is not necessarily something that you only see in older patients. It can exist in younger patients. The brow lift really rejuvenated her upper eyelid. I want you to know that no eyelid surgery itself was done. This was an endoscopic brow lift with incisions up here and here. Repositioned her brow up over her rim, and now she has this very beautiful infrabrow region, a very nice upper eyelid shelf, and she just looks much more happy. Finally, another really great result here that we were thrilled with. You can see how sometimes as you age, with relation to the bony loss that I was telling you about, her eye socket, her orbit actually enlarged, and it can lead to this hollowing, skeletonizing sort of look of your upper eyelid. And so the answer there is not to take out more skin. The answer there is to actually add volume back, because we're treating volume loss. So we will actually do fat transfer. So we will take fat from your thighs or your abdomen and process it in a centrifuge and place it under your eyes and above your eyes into the infrabrow region to give you a much more youthful upper eyelid. Here's another patient that actually got just fat. She got fat grafting to her cheeks, under her eyes, above her eyes, and you can just see that you can actually get a brow elevation by revolumizing under the eye. She actually had fat grafting throughout the face too, and you can see overall improvement of the triangulation of her face, and she just doesn't look as sullen as she did before. Those are all the before and after pictures that I have to show you, but I wanted you to also get to know my surgical coordinator. Her name is Teresa Conter. She will be someone that you interface with extensively through any process when you come through facial aesthetic concept, and she is wonderful. She is very good at her job, and she knows almost every question that you could ask. She will probably know the answer for. If she doesn't know, she will get the answer from myself or Dr. Gangness. But I just wanted to make sure you had a picture, a face to put with her name, because if you decide to come in and see us with regards to your eyes, then she is the person that you will likely talk to first. Chris, did you want to take over at this point?
Yeah. Thank you so much, Dr. Brandon. That was really outstanding. A lot of those pictures I hadn't seen before too. It's really remarkable what you can do with minimally invasive procedures. So thanks for going through those things, and I'll have to take a look at that. So we do have some special offerings I wanted to bring up for anybody who's in attendance today. There is going to be, first off, a survey that will be coming out to you after, so take a look for that in your inbox. And what we are offering as well is for the month of October, October, it looks, this year's gone away from me. So it's actually November. For the month of November, we are offering anyone who's interested in having a consultation with Dr. Brandon, they will get a gift card for $50 off any service that we offer here. So it's a great opportunity to learn more about what in particular might be something that would be of interest to you, and learn more about what's causing some of the concerns that you may see in the mirror when you when you wake up in the morning. So that is certainly an offer. And then we are offering also, if you are interested in proceeding with something before the end of the year here, you can have $250 off of that, or a $400 gift card for a secondary procedure. So those are some great things to take advantage of. Fair warning, we are getting very, very busy already for the holiday season. As many of you may know, the holiday season is a great opportunity for patients to take advantage of time that they have off of work, time away from those Zoom meetings, at least at this point in time from work, and be able to proceed with procedures that you may not be able to during a typical work time. So we have very limited slots still available, but you can schedule your consultations in November, and there are, I believe, 4 or 5 different surgical slots that are available still in December. So in addition, with any of the eye treatments that Dr. Brandon had discussed today, we are offering complimentary Latisse. As you have seen with the discussion that Dr. Brandon had, many of the procedures that he provides offer a contouring beautification of the eye, but it's also important to enhance the eyelashes, as many of you do on a daily basis with the use of mascara. Latisse is a product that's a prescription product that will actually regrow lashes and help to have a longer and fuller eyelash on the eye. So all of these things are opportunities that you can take advantage of. There will be a survey that will be coming immediately following this presentation that will give you an opportunity to please answer some questions for us about what you might want to see on our next webinar, as well as give you an opportunity to express an interest in a consultation with Dr. Brandon. And Teresa, who Dr. Brandon just introduced, will be contacting many of you following this to discuss any questions that you may have about procedures, as well as help you get those consultations on the books. So thank you very much for your time today, Dr. Brandon. Thank you very much for the presentation. It was very educational. And we will look forward to seeing you all soon. If you do have any questions that you would like addressed now, you can certainly use the chat box to send those out to us, and we'll be happy to answer any of those should they come in.
Shall I stop the screen share and then?
Sure, we can do that. So I have a question here is, what areas is fat transfer used in the face?
That's a great question. And it can be used in multiple different areas, not just around the eyes, although we have found fat transfer to be very effective in rejuvenating the eye and the eyebrow, the under eye as well. But we will frequently use it to augment the cheeks, improve jowls along the chin, improve nasolabial folds here, and temples too. A lot of people don't think about your temple, and I didn't include that in my presentation, but temples are actually a great way to restore a youthful appearing face. And a lot of people don't think about how the temporal hollowing can aid you, but it definitely does. And filling that area can really make a huge difference. So those are the primary areas. And one of the other things that we do is sometimes we'll use a very thin layer of fat, not for volumizing so much, but right underneath the skin. If you place fat out in a fanning sort of pattern, the thought is that there are stem cells within the fat that then release growth factors and promote skin rejuvenation. And in some of my patients, it's been huge. I think it really helped restore the quality and the texture and the color of their skin, maybe as much or more so as skin resurfacing type procedures like a laser or a chemical peel.
Here's a couple other in relation to that. It says, how long does fat transfer last, and is it better than filler?
Yeah, so fat transfer is considered a permanent or semi-permanent to permanent solution. So if you try something with a filler that may last 9 months to a year, depending on where you place it, maybe 2 years if you're using Voluma to the cheeks, Fat is a permanent solution. So a lot of patients who get tired of coming back in every so often for more filler will eventually transition to a fat transfer. And you will lose a small percentage of the fat initially. It's just, we do the best we can to increase fat survival, but a little bit of it does eventually resorb. But after about a year, whatever you have held onto, it's permanent. It's there for you for the rest of your life.
In relation to fat transfers, the question is, can you get any dimpling effect on the face as it settles or any other negative issues? Will it lay smoothly?
Yeah, in general, we like to use fat from the thigh. Tends to be the smoothest fat. It's very buttery, for lack of a better term. But that along with the centrifuge process that we use really helps cut down on any sort of contour irregularities, bumps, lumpiness. I personally have not had any patients with any of those issues. It is a known risk, but because of the process that we do here in facial aesthetic concepts, we don't see it too frequently, but it is a known risk and it is always possible.
There's another question about lasering under the eyelids. Can lasering in the eye area be helpful to tighten the skin?
Absolutely. Lasering is a great alternative to a surgical procedure. If you have early aging, fine lines, wrinkles, color pigmentary issues like sunspots, those sorts of things, a laser can be very powerful in resurfacing that skin, smoothing that skin, tightening that skin. Can be used alone in the office with just some local numbing cream or in conjunction with the surgery. And that's kind of the three-pronged approach that I was talking about, addressing the skin, the volume loss and the sagging, and a laser is one of the most powerful tools we have for rejuvenating the skin around the eye. It works very, very well.
Gotcha. We got one more question here so far. It's a question about eyelid lifts. Will an eyelid lift require you to be put to sleep?
So an upper eyelid lift does not require that, and that can be done very easily under local anesthesia, basically numbing medication in the office. It takes about an hour, hour and a half total to be done. The lower eyelid is a little more tricky and does tend to require general anesthesia or at least a deeper sedation. And then that is something, if you have concerns about, we can talk about in depth. If you come in to talk about it, we can take a look and see what your concerns are, and I can give you an idea of what may be required.
Outstanding. Well, again, thank you very much. Thank you very much for everyone for attending. We will look forward to hearing from you on those surveys, and we will be reaching out soon with some follow-up emails for you as well with some special offers. So thank you so much. I appreciate it. We'll be having some additional webinars soon. We'll see you soon. Take care.
Thank you, everyone.